Good evening, Malden, and I'm Gary Christensen, Mayor of the City of Malden, and we're at where else but Malden Access Television, Studio A, to bring you another update on what's happening relative to COVID-19. As I've told you in the past, I wish we didn't have to do these shows, but as long as the virus exists, we want to try and provide you with as much information as we can in Malden's battle against it. So tonight we're joined by our health director, of course, Chris Webb, who's been on multiple shows in the past. We also have, for the first time, Joe Levine, our rec director. As you can probably imagine, with phase 2 underway, we're getting a lot of questions about parks, so I wanted him to be here to give you the latest in Malden's plan to reopen different parks throughout the city. And then finally, we have Christian Lanphere, who's been with us on multiple occasions as well. He's from Cambridge Health Alliance. He's the Emergency Management Director, Safety Officer, and the way he's been going with us, I might start calling him the COO. So I want to thank him. And then, of course, this is all organized and administered by our Communications Director, Ron Cochran. So thank you to him. Thank you to Malden Access Television. And most importantly, thank you for continuing to work with us as we make our way through this pandemic. So as we typically do, we're going to have our guests make short introductory statements. Then I will ask them a question, and then most importantly, we'll get to your questions. So Mr. Cochran, let's hear from our invited guests this evening.
Thank you, Mr. Mayor. First, we're going to go to Christian. Christian, go ahead.
Good evening, Malden. My name is Christian, as the mayor said, and I'm coming to you tonight to answer any questions you may have, particularly around the COVID response and providing you with the hospital's perspective. What I will tell you is that we joined the state today, along with 16 other organizations in 50 locations, to start testing activists and demonstrators who have been partaking in demonstrations across the state. And we are beginning a 3-day testing period for anyone who wants to be tested who has been involved in any public demonstrations, and feel that either if they want to be tested just for their own comfort, or they want to be tested because they're concerned.
Okay, thank you.
Okay, next we're going to go to our Public Health Director, Chris Webb.
Hello, everybody. Glad to be back again. Glad I'm still healthy enough to be here. Hopefully you are too. We've got a couple of questions that came in this week, and I wanted to let you know that I've answered all you, so check your emails. And looking forward to working with both Christian and Mr. Levine on the reopening of the Recreation Department for all intents and purposes, and with CHA on the senior on-site testing program that we're starting this week with the building at 280 Salem Street. I'll talk more about that later.
Excellent. All right, and finally, Mr. Levine.
Hello, everybody. I'm excited. The parks are finally open. It's good to see some of the people that I haven't seen 3 or 4 months out in the parks, throwing a ball, running around the track, and having a little fun. And right now we're kind of on a limited basis. We're in phase 2, and there's guidelines to that. So we'll talk about that later. But it's an exciting time. Some good fun stuff will be happening in the next month, I hope. And I'll answer any question that you have.
All right, great. Thank you all again for coming tonight. And again, I'm Gary Christensen, Mayor of the City of Malden. You may not recognize me, but I finally got my hair cut for the first time since mid-February. And it was done by none other than Paula Angelo out of the famous Edgeworth neighborhood in the City of Malden. So I want to thank her for making me feel new again. So let's put you all on the web. This is the part of the show where I get to ask you any question, and you can't assign it to someone else, or you can't bring it back and then come back the following show and answer it. You have to answer it right here and now. So this is a segment that we've utilized from the world famous show Around the Rim, hosted by Nestor Dudley. And again, it's called In the Web. So let's go in the web. And the first question I have is for Christian Lanphere. So we've been informed by Cambridge Health Alliance that they're going to begin winding down the free testing. So I wanted to ask you, is that a sign that we are making big strides relative to COVID-19, or is it for some other reason that we don't know about?
So I think the reason why we've decided to start winding down the tents is that that particular location actually is covering 7 communities. And, I think it's the weather, it's warmer out, and people are starting to feel more confident, and they're just less likely to want to be tested. But in its place, we are going to start connecting closely with the Board of Health and start doing targeted testing in other key areas of the community with our partner Cataldo Ambulance Service. So we will continue to register everyone in senior housing, low-income housing, and other areas, congregate housing, where the Board of Health is concerned about or wants to do outreach to ensure that the residents in those areas feel confident and safe that they do not have the virus.
Christian, you at liberty to say the date that the tents will no longer be up, or is that still being worked out?
Nope. So our last day to do public testing at the tent will actually be June 26th.
Okay.
At 4 p.m. So that'll be our last. And in its place, though, we're going to begin looking at doing A1C testing for our patients, who really, particularly our diabetics, who have who have really not been able to see their primary care provider. And this is an opportunity for us to do more outreach with them without having them to get too close into the clinic setting.
Okay. Mr. Levine, let me go to you next. And as you've probably seen or heard, one of the top issues for me on Instagram is going back and forth with the youth about the reopening of the basketball courts. So first, let me ask you, I know we don't have them open because under the governor's order, I think it prevents contact sports from happening at this point. Do you agree with that? And second, when do you foresee that, those courts being reopened, if you had to guess?
Well, after speaking with Chris Webb, we do follow the phases, and I understand, the contact sports, we're not really allowing that right now. So I would have to say in about a month or so, we'd be able to play some basketball games, I'm hoping. That's kind of a prediction, and if all goes well, that may be in the plans. It's really difficult to keep guys and girls off the basketball courts. It's just, it's difficult, but we're getting there. We're getting close.
Okay. All right, thank you. And then finally, Mr. Webb, let's put you in the web and ask you the question. Are you concerned by what you're seeing across the rest of the country with what we're being told is an uptick in cases?
Yes. Anybody would be naive not to be. The phases we're going through right now are going to tell us the same thing. And that's why a lot of people are saying late August, October-ish, that's going to be really the bellwether. And that's probably true because of the demonstrations that have been ongoing and some of, the relaxing of, I was going to say norms, but the relaxing of the new normal, which is the masking and disinfecting and hand washing. I'm sure a lot of people have even forgotten about hand washing and disinfecting, but it's still very, very important. And limiting your contact. I understand everybody's right to peacefully assemble, and I respect it, but I would have rathered a different time. That's all. I totally understand the point of view and agree with them wholeheartedly, but it could have been a better time. That's all.
And Mr. Webb, I know in the notes that our Chief of Staff, Maria Luis, gave me, you're still recommending the wearing of the masks, washing the hands. I think you just mentioned the social distancing. All that you believe will be in effect not just this summer, but into the fall and perhaps until we come up with a vaccine?
Yeah, I would think those people who are immune compromised or have had other family members who got severely ill or even passed would want to, at a minimum, to have the mask for those circumstances where it is too crowded. Mm-hmm. I think will make a lot of sense to people until there's a vaccine to have a mask handy for those circumstances where you're not sure where everybody else you're surrounded by has been. Okay. And I don't think many people would think it was rude. You just don't want to go be out of work. You don't want to be away from family, whatever the circumstance may be. So I fully expect masks to be a standard. I've seen a lot of really nice masks out there.
Okay. All right, well, you've all survived the first round of questions. You're out of the web. Now let's go to Patty, our first caller.
Well, Mr. Mayor, I'm sorry to say someone has dialed the number quicker than Patty. So the thing is, if we don't hear from Patty as the second caller, I think we're going to probably send a wellness check out, make sure Patty's okay, because we're getting a little worried.
All right.
But let's hope she joins us. But first up this evening is going to be Joan. Joan, go ahead. You are on the air with the panel.
Okay, thank you, gentlemen, again for being here tonight. It has been exciting seeing people out and about. And my question is about a neighboring city has had their drive-in movie night. I don't know if you know about it, but it was very successful. People were very happy. They stayed their distance in their cars, and they were able to do this at a park. And I just wonder if this was something that we could do in Malden, say at the Pearl Street Stadium or someplace where we would be able to come outdoors and see people, not necessarily shake hands or whatever or hug,
Right.
but just something to look forward to. Do you think that's something that Malden could have or do?
I do, but let's go to our director, Joe Levine. Have you thought about this, Joe, or
Yeah,
has anybody approached you about it?
Actually, before this all came about, I was actually thinking about buying a TV and having a movie night down at one of the parks for, the Alloc basketball players, the ninth graders, just youth of the city, and watching a basketball game or a movie with them. But there is no reason that we couldn't do something like that in the future, whether it's a drive-in or use a school parking lot to do something like that. It's a great idea. I love that idea. And, excuse me if I steal that idea sometime.
All right, well, let's get Joan's information so we can invite her.
Absolutely.
Well, thank you.
Joan, what kind of movies do you like?
Family movies?
All right, I'm glad you didn't say horror, because I don't
Oh,
like
no,
horror.
I hate horror movies. Family movies is, I love the Hallmark stations.
All right.
I like that.
All right, I'm going to
That
make a
would be
note of that,
great.
Joan.
Great.
All right, thank you.
Thank you very much. Okay, good night.
Good night.
Bye-bye.
All right, Ron, who's next?
Okay, next up, we have a question off of Facebook. Susan asks, do police and fire have to wear masks? She saw them respond to a few calls last week and saw situations and circumstances where they were not wearing a mask.
Well, Mr. Webb, I believe they do when they're responding, correct?
The policy is that they will wear a mask whenever responding, when possible. Sometimes it becomes an issue. They've been to the property before and they need that person to know who they're dealing with because they may have had an personal interaction before and, certain agreements were made in the last time they met. If I have to come back here, you're going to have to go to treatment or you're going to come in with us. They want this person to know who they're dealing with. That I've seen a few times so far.
Okay.
Oftentimes it's really just they have to be so responsive. They have to drive the car. They have to get there. And they got to get out of the car and be responsive. They just don't have time to grab the mask. Invariably, once they've started their initial investigation and they start the actual investigation, they mask up.
Okay. And if they have specific questions, I would recommend they contact Chief Kevin Molas at the Malden Police Department. I'm sure he would be willing to discuss with you further the parameters around when officers are wearing and when they're not.
Okay, well, thanks for that. And next we're going to, I believe this question is probably of both Chris and Christian both. How long will contact tracing continue? And now that we're rolling into sort of a different phase in the decline of cases, how does that affect contact tracing?
Go ahead, Christian.
Contact tracing has been incredibly important at the height of this epidemic. but it's also as we come down from the cases, it's still going to be critical for us to identify positive cases, and especially as people are getting out and about more often, it's critical for us to sort of investigate from them directly how much, where they've been outside, if they've been wearing a mask, if they haven't been wearing a mask. If they haven't been wearing masks, we do still need to do contact tracing, particularly if they are in any restaurant establishment that has recently opened. Even though it's outside, I still think that there is contact tracing still important, especially to identify those who are asymptomatic.
Okay, Mr. Webb?
Well, by law, COVID-19 being a reportable disease or a communicable reportable disease, we'll be doing contact tracing until there are no more positive cases. They get reported to us electronically, and we have to start our contact tracing upon receipt. So I would think until there's a vaccine, we'll be doing them.
All right, Mr. Webb, while we're on the topic, can you give the latest statistics? I know we typically do that at the beginning of the show, and people are always curious when watching what the latest is relative to where we are.
Today's case number is 1,211 with 80 deaths.
Okay, and the numbers, as our communications director alluded to, what are we averaging now a day? I mean, at the height, we were at what, 30 a day, 40 a day, and now what is it roughly?
3 or 4.
3 or 4, okay.
Yeah.
Okay. All right, I think we have a caller, Ron?
Yes, and I know this is, a lot of us are really concerned about coronavirus and all the things that are in society, but I will say this, one less thing on our list to be concerned about, and that's Patty's whereabouts. Patty, go ahead, you are on the air with the panel.
Hi, Gary.
Hey, Patty.
I had a letter. I got a letter from Mass Ioneer.
Okay.
For COVID-19 emergency relief fund. And now they said here, they are also proud to share some exciting news. Mass Ioneer is currently leading an effort to develop an experiment COVID-19 vaccine based on an adeno-associated virus, AAV,
Okay.
that we believe will be safe.
All right, and so you're questioning the validity of that, or?
Yeah.
All right, let's go to Mr. Lanphere and Mr. Webb. You heard of this?
So this is the first I heard of this one. The one that is, there's 2 pharmaceutical companies in Cambridge who are leading the effort. The one that comes to mind is Moderna. They are the company right now that is currently either going from phase 2 to phase 3 at the moment. The one that Patty's referring to, though, this is a new one for us to hear. The other one that's getting a lot of traction is out of Oxford in England.
Okay. Mr. Webb?
Yeah, I haven't heard of this particular one. There are many. Some haven't even announced yet, even though they may have gone on to phase 2 in their testing. So it's going to be a while before I would put my faith in any one product or vaccine.
So, Patty, I would steer clear. If you want, you can have Councilor Crowe look at the letter, or I can look at the letter for you, but do not commit until someone else looks at it.
Yeah.
If that's what you're thinking,
Yeah, I hope we get either that or by the end of the year. Can't go another whole year.
Well, let's find out from Mr. Lanphere and Mr. Webb, what is the latest relative to a vaccine? I think they just mentioned, right, is Mr. Lanphere, when you were talking about the company in Cambridge going from phase 2 to phase 3, is that ahead of schedule?
So I think I think all of these are, vaccines can take a quite long time to get through the hurdle, but they're under emergency use orders at the moment. I think we've fast-tracked this, similar to what we've done with H1N1 back in 2009, 2010. So, really what phase 2 to phase 3 now is that this is still a controlled study, but it now is taking into a larger count of people into the study group. for testing. And, it'll still take us some time to identify the efficacy of the vaccine. And one of the key things that, researchers need to understand is, how does someone who's been vaccinated get exposed to the virus, whether we'll know whether it works or not. A lot of this in phase 1 was done in research in laboratory animals. Now that it's moved into human trials, both from phase 2, which is a small number of people, and then to a much larger group of people in phase 3, I think there's still a lot more that we need to know about the efficacy of the vaccine and whether it works or not.
Okay, Mr. Webb, do you think, where we are right now is what you would expect, or do you think we're a little bit ahead of schedule?
We're definitely ahead of schedule. And whenever you're dealing with a federal regulatory agency and you're going faster than they're used to, you have to be somewhat concerned that they're not going to give up the ship and just let these drug companies do what they want to do just to get to market. That's a lot of people's concern. Legitimate or not, I don't know. I'd like to think there's enough watchdogs on the process, but I think you're going to see a vaccine probably will not come out for a full 24 months at best.
All right, well, sorry to end it that way, Patty, but just continue to try and hang in there, okay?
Yeah, should I get in touch with Kate Crow and have her read this, or
Yes.
I'll read it to her?
Either or. I would just give Counselor Crow a call, and she'll figure out what's best in terms of trying to give you some advice. But don't do anything without first talking to her or myself.
Oh, yes. Kate Crow, right?
Yeah.
Yeah.
And if you can't get a hold of her, just reach out to me, okay, Patty?
All right. Where?
All right.
Still the same number? Yeah, phone
Yep.
number, right?
Yep. All right, Patty.
All right.
Thank you.
You're welcome.
Bye-bye.
Bye-bye.
Thanks as always to Patty. Next, we have a question from Rose Kilbride, and that name should sound familiar, Mr. Mayor. Sean, mother of Sean Kilbride, otherwise known as Deputy Mayor of Malden, right? Yep. And we have a great question from Rose. Rose says, first of all, she asks or thanks the panelist and you, Mr. Mayor, for all the info that's come about through the show.
Pleasure.
And she wanted to ask you to encourage folks to properly dispose of masks and gloves. Sadly, I see them all over the city, and she's hoping that can improve.
All right, yeah, without a doubt. Mr. Lanphere, Mr. Webb, what's your, I think it goes without saying, right?
Yeah, I think it's just common decency and respect for your fellow citizen to, pick up after yourself. Nobody knows what's on those gloves. It's just common decency to put them in the trash.
All right, Mr. Webb.
Yeah, I agree. These isn't nuclear waste. You could put it in your car. I mean, it was on your body. So putting it in a plastic bag, you close up inside your car, or a brown paper bag inside your car is less likely to cause the next guy that has to clean up after you to expose himself or herself. Right. So there's the point of consideration.
Yeah, and to both you, we have plenty of receptacles around the city. I mean, it shouldn't be a matter where you can't find a place to dispose of it. I think we have 30 or 35, city receptacles through that creative outdoor advertising. So there shouldn't really be an excuse. So we'll continue to, promote that. And thank you, Ms. Kilbright, for bringing that to us. And as always, please say hi to Sean. I miss bowling with them on Sundays.
Okay, great. Our next question is for our rec director, Joe Levine. Joe, are there currently rec programs scheduled for the summer? And if so, if you could do a summary on the status of those and what we've got lined up.
Well, we're just promoting something for adults the last 2 weeks. We're collaborating with Core Cardio Fitness on Commercial Street. And he's nice enough to run a boot camp for us on Saturdays and Sundays at McDonald's Stadium. We are able to take about 40 people per session because we're going to have 4 instructors and we're going to be spread out through the whole field. It will be safe. We'll be social distanced, and people will have masks. And for more information on that, you can go to our website, maldenrec.com, on programs. We haven't started any youth programs yet. We're just waiting for that next phase to kick in to kind of see where we stand and what we can or cannot do. But we do have some good stuff coming up, hopefully in the fall, some new and improved programs that we're putting together. But as of right now, for the summertime, we did cancel our summer camps. We felt that we weren't able to accommodate the amount of kids and keep them as safe as they should be during this epidemic.
So, Mr. Levine, the only real positive outcome is that the mayor's sponsored team from last year, which won the championship, continues to reign.
We're trying to get that last playoff season, playoffs in. We're fighting against the clock to get it, but we'll try. But
okay.
Yeah, I think your team's going to be all right for another year.
All right, thank you, Joe. All right, do we have a caller now?
Not as of now, but we do want to remind folks, if you do want to call into the show, the number is 781-388-9394. And of course, we're always checking Facebook for any new questions. If you want to message us there, and we'll pop over to the YouTube live feed that MATV is running, and we'll look there as well. And also, if you don't mind, Mr. Mayor, I'd also like to take the time to point out my fancy virtual background, which I commandeered from a recent press conference that you had. And I don't know if you want to go into that, or I'd be happy to go into that too.
I think, yeah, why don't you? And let's play it.
Well, all right, I'll cue that up while we're taking these questions, and then I'll ask the MATV folks if we can go out with that. But just to remind folks, the census is still around and running and happily taking entries from all residents across the country. But in particular, we are really asking our Malden residents to go ahead and take the time to fill out the census. I've personally done it, and my time was, I think, 9 minutes and 40 seconds. I timed myself, and we've heard even quicker. And just that short amount of time can really help with getting proper resources to our city being accurately counted. And if you want to go ahead and take the census, you can do so online at census2020.gov.
Great, thank you, Mr. Cochran. And I think I heard the phones ring. Do we have a caller?
I believe we do. Okay, so next is Lee. Lee, go ahead. You are on the air with the panel.
Good evening, Lee.
Hi.
How are you?
The track in Malden at McDonald Stadium, what time does it open in the morning? And also, does Malden oversee the track at Pine Banks Park, and what time does that open?
All right, Mr. Levine, take it away.
Okay, I can speak for McDonald Stadium. Our hours are 8 a.m. to 8 p.m. Monday through Friday, and Saturdays and Sundays 8 a.m. to noon time. We open the place up, and you're free to walk the track, run the track, or if you wanted to use the field for some exercises, you're more than welcome to do that. Pine Banks is another entity, and I don't know what their hours are over there.
You know, Lee, we'll try to look that up right now. I see Mr. Cochran checking their website to see if we can provide you that information, but they're run under a separate board from us, from the city of Malden. It's actually a Malden Melrose board.
Yep,
Okay,
I have
thank
it right
you
here.
for the
Park
information.
hours are 11 a.m. to 12 a.m. That's park hours, and I'll see if they have some expanded. They don't specifically mention the track. Let's see, field area is 7 field area is 7 a.m. until sundown or till 11 p.m. normally, but let me see if I can find out. I'm going to try to get a more specific answer, but it looks like 11 a.m. is just general park hours.
So, Lee, stay tuned, and we'll try and get that to you before the end of the show.
I appreciate it. Thank you very much.
All right, Lee.
Bye-bye.
Okay, our next question, I think, is for Chris and Christian, and that is, do we feel like we're out of the woods on this? Where are we with respect to recovery in general from the virus? Are we on a path that we thought we would be? Are we out of the woods? Are we close? And what could pull us back?
So I'm happy to go first.
Go ahead, Christian.
I don't think we're in any ways out of the woods yet. I think we need to be cautious I think we still need to adhere to social distancing, wearing masks. And I think more importantly, we need to listen to our public health experts who have our best interest at stake. I think there are still opportunities, which we've seen across the country as other communities start to open up, but also as we begin the warmer months, people wanting to take off masks. I still think that there are real risks out there, and we still need to tread very, very carefully. And I do think that there could be a resurgence at any point, and I think we just need to keep our guard up and continue to keep each other safe.
All right, Mr. Webb?
I'd agree. We're not anywhere near out of the woods. Again, the goal, end zone for us is vaccine. Anything short of that means social distancing, masks, good hygiene, and stay away from people. So much to the point, actually, the Board of Health had a meeting on the 11th and gave a lot of consideration to the issue of gatherings, knowing what's going on in the world right now. And because there are so many of these spontaneous gatherings, that they decided that to keep the curve down, that they would suspend any other municipal gatherings. Of course, people have the right to exercise their right to peacefully assemble and free speech, but some of the festivals and concerts and, well, all of them will not be held this year because of the concern of adding large gatherings on top of large gatherings. And mathematically, it doesn't work. It will raise our number. Another thing, small matter, but important, the tables and chairs you see in convenience stores for playing Keno where people congregate, those have been removed until further notice. I don't know that they'll ever see their day back into a convenience store, but that's something to be discussed at a later date. And, we're still doing testing. We're trying to find very vulnerable groups and test them. That's why we have the on-site program through the graces of CHA and Cataldo Ambulance. We're going to actually go on site to senior housing and low-income housing and congregate housing to get the people who are most likely positive. They're just not having the right diets. They may be morbidly obese. They may have a lot of underlying medical conditions, and they may have age working against them. So it's important to keep gathering this data. It helps feed the vaccine, distribution, of course, which is most important once it's made, but it also informs what the vaccine has to be able to do to be effective.
Mr. Webb, let me ask you this. With phase 2 underway, I think it's the first step of phase 2. Have you been spot checking some of the outdoor dining? And if so, are you finding that we're complying?
Well, amazingly enough, we only have one complaint. I wouldn't even say it's a complaint. Someone requested we give them their point of view on an establishment, but the other ones, all the ones that are actually open right now, we have checked. John Brewer's is doing very well. I was by Three Amigos this afternoon, early evening. They were doing very well. They actually had a very small line. That's something we're going to try and get rid of entirely at all these places and remind them that people have to wait in their cars and be called. It's important. So overall, I think they're doing very well. We haven't had any sanitary code violations, so that's always good. Staff seems to understand what they're doing. And if there are any complaints or issues, please call the health department and let us know. We'll work with these establishments to get everything right. The last thing they want is to get anybody sick.
Okay. And Mr. Cochran, I know also another aspect of that question that was asked in the Metro Mayor's call that we participate in, which is organized by MAPC, the Metropolitan Area Planning Council. We had a Dr. Walensky on there recently who heads up infectious diseases at Mass General Hospital. And I asked her, I said, after 3 or 4 months, what's been the difference maker? Is it the, all of the measures that have been put in place, or is it that COVID-19 is starting to peter out, or is it the weather? And she didn't flinch when she said it's all these measures that have been put in place. So it might not seem it, but she's convinced that, 80–90% of it is from what we've been doing. So we don't want to go back. I know our Chief of Staff, Maria Luis, who's been the liaison up in our office, we always look at the number of people who have passed on, and, it saddens us, and we don't want any more. And so Dr. Walensky said the way to do that is as difficult as we have to continue all the measures that are in place, so. All right, so do we have another? I thought I heard the phone ringing.
Yes, we do have a caller. Hang on one second.
Susan.
I believe we have Susan. Susan, go ahead. You are on the air with the panel.
Okay. Hi, Mayor Christensen.
Hi, Susan.
I think this is a question maybe for the Board of Health.
Okay.
I'm wondering about bringing our own bags to the stores. I think this is a city decision. Now that we're using plastic bags during this time, is it possible for us to bring our own bags as they sell them in the store? And I don't really see much of a danger. I don't know. I could be minimizing. But is this a possibility of bringing our own bags in versus getting 2 things in each bag in a plastic bag?
And Susan, give us an example.
I work for Stop and Shop, and I know how to pack a bag.
So you're talking relative specifically really to Super Stop and Shop?
No, it's everywhere.
In general,
all the
okay.
stores. But I think it's a city decision.
All right, let's
just
go to
like the plastic bags were.
Yeah, let's go to Mr. Webb to find out the latest on that.
Okay, good question, actually. The city of Malden has an ordinance about plastic bags not to be used for environmental reasons. That was overridden by the governor in the Department of Public Health, who had determined that there was at least a likelihood of some sort, probably a high likelihood, I'd have to say, that reusable bags would be a transmission source, because you depending on how close you are to the store and how long it takes you to get in and all these other factors, you're handling the bag, someone else is handling the bag, you're walking through someone else's jet stream. These are all issues that they don't want you to have to deal with. So use disposable bags, get through the process, and then dispose of the bags. That way you're not having maybe viral-laden bags laying around the house. And you can't disinfect them as much as you try. You probably wouldn't do a very good job with the cloth handles and all.
And so, Mr. Webb,
well,
is that still
they sell them.
Is that still in effect, Mr. Webb?
It is.
Okay. Go ahead, Susan.
I said, yet they sell them. Like, how would they sell something that you cannot use?
Well,
they aren't selling them now. They've been pulled from the shelves. You can't buy them now.
Okay.
It would be illegal for them to do that. We'll
Right,
double check
yeah,
it tomorrow for sure, but that's
I see them
Stop and Shop knows better. They can't
at
do
the
that.
stores, so I don't know.
Susan, which stores?
Okay, well, thank you for that info.
Susan, which stores are you seeing that they're selling the bags?
Well, again, I'm just thinking of Market Basket. I go to Stop and Shop, and I haven't really looked.
Okay.
So in Market Basket is in Revere, so
Okay.
you're not responsible for Revere.
Right. All right. Thank you.
All
I'll
right,
pass that
thank
on
you.
to my friend Nick Catanzano in Revere.
All right.
Okay, thank you.
Thanks, Susan.
All right, bye-bye.
Mr. Cochran, do you have that information on Pine Banks Park for Lee?
We're still trying to check it down. It's a little unclear on their website. I don't want to give the wrong information.
Well, you know
so
what
I
to
think
do? Why don't you give the phone number and website maybe at a minimum at some point?
Yeah. Yep, we'll do that. We'll do that now, and we can do it at the end of the show as well. The phone number for Pine Banks is 781-324-0822. And the email address is info@pinebanks.org. And of course, their website is pinebanks.org. But I will try to track that down within the next 10 minutes or so before the end of our show.
All right. Thanks, Ron. I think I heard a call.
Okay, no problem. Yeah. Well, more good news, too. I was able to track down your press conference. So I think what we'll do is go out with that. But actually, we do have a question that came in earlier, and it's we'll stick with the Stop and Shop theme. There was some concern that the person expressed about Stop and Shop having a number of masks and gloves in their parking lot, was hoping that could be addressed directly with them, either by providing more trash cans or maybe some education to the staff that is the case.
All right, Mr. Webb, I know you periodically check in over there, right?
I do, and I was there today, and the parking lot looked pretty good. But
Okay.
that doesn't mean that the weekend it didn't get a little out of hand, and sometimes it does. I'll make a point to look at it. But I'll talk with management tomorrow and remind all the supermarkets of the requirements.
Okay, thank you.
Okay, our next question is about our parks, and in particular, dog parks, as well as playground equipment. So those are two questions we get very frequently, whether or not those are open and active. So dog parks and the playground equipment within our parks.
All right, Mr. Levine, Mr. Webb?
So Mr. Webb could speak on the dog parks. I'm not positive on those being open or not.
All right, are the tot lots open, Joe?
The tot lots are opened. They were opened Monday. There are signs up telling people to keep social distancing, wearing masks, and et cetera. So they are open.
Okay, Mr. Webb, what about dog parks?
Dog parks are open
Okay,
Okay.
all right, so they
with
have.
the typical restrictions.
Yeah.
Social distancing, clean up after your dog, try and keep the dogs apart as often as possible. Things
Okay.
like that, whatever's practical.
Okay,
Getting back to our Pine Banks, we actually had more people trying to track this information down, and unfortunately, the answer got a little murkier. So I think what we're going to do is we're going to deflect this one for now and hopefully find a good response here. And then I'll personally reach out to the Pine Banks folks to try to see if we can get them to tighten up, those hours to make it a little more clear for our residents anyway that want to utilize the fields.
okay.
Okay, I think we do have another caller here. And I'm hoping I'm pronouncing this name correctly. Nishal, go ahead. You are on the air with the panel.
Hey, I have one question for the board. How many active cases do we have as of now in Malden? And how do we make sure that if we have any cases in apartment, we are getting the information from our management so that we can be more careful if we have any cases near around to our home?
All right, Mr. Webb, one more time, the latest on the number of cases Malden currently has?
The number of cases currently is 1,211 positive cases with 80 deaths.
Yep, and you've seen that come down from, I think, a high of 30 a day to, maybe a half dozen a day or a handful?
Yeah, I think that's fair to say. It's about 3 or 4 a day right now.
Yeah, okay. Now, I think the caller was asking about, large apartment complexes. What's the protocol there? Are they required to notify tenants if someone does have it within the building?
Another good question, but the answer to that is no.
Okay.
People's private medical information is private.
Okay.
Doesn't have to be shared with anybody. Know this, though, that if someone were sick enough and they posed a risk to anybody else in the complex, we have the authority to remove those persons and put them in a place that's, one, better for them, and two, safe for the people that they live with.
Okay. And if the caller wanted to get a hold of the health department, what's the phone number and email again?
Phone number is 781-397-7000, extension 2049.
Okay.
And the email is boh@cityofmalden.org.
All right, great. Thank you. Thank you.
Thanks a lot. Thanks for providing this information.
Thank you.
Thank you, Nishal. And our next question is about hand soap. If Chris mentioned it earlier, which is great. I'm glad you did. Let's go back to the old thing that we asked you to do at the very outset. But soap in particular, does it need to be an antibacterial soap or can it just be a standard soap?
Another good question. And it's funny, the food code has done a little research on hand washing prior to the pandemic. So what they had come up with for restaurant hand washing regulations, which is applicable here, is you need 100-degree water, which is basically a little tepid, and hand soap. Doesn't say anything about antibacterial, although obviously it would be better. But the main thing that gets your hands bacterially free is friction. So it's important that You use soap to help the motion and get, water and you can see where you've washed. But the main thing is friction. The more you rub, if you rub for Happy Birthday song twice, chances are you will have physically destroyed any virus on your hands.
Okay. Thank you, Mr. Webb.
Yes, sir.
Actually curious to know, I've always heard the happy birthday thing for the timing. Christian, what's your take on the timing of it? What's your technique for keeping people washed a proper amount of time?
Yeah, so we use the happy birthday song as well. But this virus is really easy to kill. It doesn't take a lot, but it is 20 seconds. It is a minimum of 20 seconds. And I want to I can't underscore the fact that what Chris said is the friction is the most important part, and you've got to get to the hand webs but you've got to do this for 20 seconds, and that will sufficiently kill the virus. So we use the happy birthday song as well for this.
Okay, sounds great. Just to give a little time check here, we're just about 5 minutes until the end of our program. And I guess during all this time, had Mr. Levine was busy doing some research in his household about Pine Banks hours. We're going to go to you. You have a response now.
Yes, I just spoke with the director over there, and what he said is sun up to sundown. The track is open 24 hours a day. So, you get in there, do your thing, and exercise all you want.
Joe, that's 7 days a week?
Yes, it is.
Okay, there you have it, Lee.
And this is probably advantageous because we're probably at the peak amount of daylight as it is now, getting quick to the summer solstice here. So that's about, I think probably sunup is probably on the 4 side, and I think sundown is even after 9 p.m. So that's great. Thank you so much for that info.
All right.
We're at that moment now. I'm going to do a quick scan, but we do like to go to our guests for a little bit of a closing statement. But first to you, Mayor, if there's anything you wanted to mention prior to that.
No, I think we go to our guests and then I'll lead us out.
Okay, I think we'll start in reverse order here. So, Mr. Levine, would you like to take us out with some final thoughts?
Yes, we're looking forward to getting things off the ground, and I'm also looking forward to working with the Malden Police Department, their resource officer, Trent Headley. We missed our basketball season this year, the Mac Singleton Basketball League, that the mayor's team has won the championship 2 years in a row. So we missed that this year, but we're looking to do it again. We'll do some fall things, and we're also interested in working with the police department and starting a street hockey league down at the Linden Rink. So this is something new that we've talked about. I've talked with our resource officer. He thinks it's a great idea. So that's something we're going to do in the fall, and it's a new thing that we've talked about. And we're going to have a little fun this fall. We'll make up for some lost time.
All right, great. Thank you for coming, Mr. Levine. Thank you.
Thank you for inviting me, sir.
Okay, and next we're going to go, I believe, to Chris Webb.
Sign me up for that hockey league. I'm in. Whatever it takes, I want in. I just want to remind everybody, like we started, we try to start every show that way, is stay with the basics. It's gotten you this far. If it's working for you, keep doing it, and minimize your interactions with people that you don't know where they've been. It's really not that complicated. I understand that it's been frustrating in many levels, but what would be more frustrating than this is starting over, and nobody wants to do that. Just imagine that, okay? So stay focused on the prize. And if you have loved ones in the senior housing, make sure you get them registered for their on-site testing. It's important. It will probably ease their minds. And of course, the information that we get for feedback on that will tell us whether we can lift the no visitation rule, which is something.
We may have had Chris cut out on us. I think what we'll do is we're going to go ahead and Christian, why don't we go to you, and then we'll come back and see if Chris is back with us.
Okay, well, I want to thank the mayor. I want to thank all the residents of Malden. What I want to leave everyone with is that we each have a civic duty now. and that is to wear a mask. So I wear a mask to protect you, and you wear a mask to protect me. So this is really how it works. And I think together, this is how we're going to get through the pandemic. So I want to thank everybody for inviting me here today. We're still here, and we will be here to keep the residents healthy. So thank you.
Thank you,
All right,
Christian.
Christian, so if people want to reach you, what's the phone number and email address?
So people can reach me up at the hospital at 617-665-1000. They can just ask for administration, and that's where they can get me. Others can also get me at 617-381-7100, which is the administration office. And my email is Lanphere, which is my last name, Lanphere @challiance.org.
All right, very good, thank you. And Joe, can you just give your phone number and email once more if you haven't already?
My email address is Levine, L-E-V as in Victor, I-N-E, @citymalden.org. And my number at McDonald Stadium is 781-397-7168.
All right, great. And did we get Mr. Webb back?
We actually just heard from him via text, and he said technical difficulties, unable to sign back in. So he said happy to be there, and good night.
Okay. All right, well, let me thank him and all our panelists, as well as our communications director, Ron Cochran, and of course, Malden Access Television for continuing to have us here in Studio A. I think what everyone else said, I'll just join in and say 3 words: don't let up. So we have to continue what we've been doing, because we don't want to go back to where we were. So thank you for tuning in. We'll be right back here again next Wednesday at 7 p.m. In the meantime, stay safe, Malden.